from the side effect of the diabetes, I've had 5 strokes, I've had 8 stents put to my heart, I've had open heart surgery, partial amputations on both feet, I have cataracts and glaucoma now, and high blood pressure, and I have high cholesterol. That's before I found out what I needed to do to correct it all.
Sharon Boykin has diabetes. She has suffered from heart disease and required bypass surgery because she was unaware of the link between diabetes and heart disease.
What most people don't know is that people who have diabetes, even if they've never shown any sign of having heart disease, are at the same risk for heart disease as somebody who's already had a heart attack.
Research shows that controlling blood sugar, blood pressure, and cholesterol are critical in preventing heart disease and stroke among people with diabetes.
We call this approach the ABCs of diabetes. A is the A1C, a measure of how well the blood sugar has been controlled over the previous 3 months. B is blood pressure, and C is cholesterol. Recent clinical trials have demonstrated the importance of all 3 of these, and we know that controlling the 3 can dramatically reduce the risk of cardiovascular disease and other complications of diabetes.
Diabetes is most common in adults over age 40, but many of them don't realize what they can do to prevent 2 of the disease's most serious complications.
As the population ages, we would expect some increase in the proportion of people with diabetes. And though it seems simple, it's amazing how few people with diabetes recognize the importance of blood pressure, cholesterol, and diabetes management to prevent heart attacks and strokes.
If I had paid more attention to this years ago and changed my lifestyle then, I probably wouldn't have had to have open heart surgery or the stents. But now I have permanent heart damage, so the only thing I can do now is to just live to survive.
People with diabetes should work with their doctors to monitor the ABCs of diabetes.
We want patients who have diabetes to ask their doctors, what is my A1C, my blood pressure, my cholesterol, what should it be, and what can I do to get there?
Sharon Boykin understands the benefits of following this approach. She lost weight in order to control her diabetes.
By knowing what your ABC levels are, you'll be able to help save your own life. The lower they are, the better chance you have of living. Your living conditions will be better.
Knowing your ABCs will help you reduce your risk of heart attack and stroke to live a longer and healthier life.